While the World Health Organization says it has approved the Sinovac vaccine, CoronaVac, for emergency use. It joins China's Sinopharm on the WHO list, and this opens the door for the jab to be used in the COVAX program, which aims to ensure fair access to vaccines. Toni Waterman has more in Brussels.
The backing from the WHO means there will be another option available in the fight against COVID-19, particularly in developing countries where vaccines remain scarce. Many of these countries do not have their own regulatory bodies, so they take their cues from the WHO on which vaccines are safe to use. The approval also clears the way for Sinovac to join the COVAX facility, the global program to bring vaccines to mainly low-income countries. That program is facing a severe supply crunch at the moment and is expected to be 200 million doses short by the end of June. Sinovac and Sinopharm, the other Chinese vaccine approved in May, could help ease some of the bottlenecks. Both can be stored at normal refrigerator temperature, so it makes them prime candidates for use in underdeveloped countries or in remote areas. This backing from the WHO, though, is also a vote of confidence in Chinese vaccines, which had faced questions over efficacy both at home and abroad.
Today, I'm happy to announce that the Sinovac CoronaVac vaccine has been given WHO emergency use listing after being found to be safe, effective, and quality assured following 2 doses of the inactivated vaccine. It's now crucial to get these life-saving tools to the people that need them quickly.
The WHO is recommending Sinovac for adults 18 years and older, and while it noted there was limited data on the vaccine effectiveness in people over 60, it said there was no reason to believe that the shot would be any less effective. According to the WHO, the vaccine prevented symptomatic disease in 51% of those vaccinated and prevented severe COVID and hospitalization in 100% of the studied population. Sinovac is now the second non-Western vaccine approved for use behind China's Sinopharm, but it may not be the last. CanSino Biologics, another Chinese producer, has submitted clinical trial data to the WHO, but that review has not yet been scheduled. Toni Waterman, CGTN, Brussels.
Now for the latest on that, let's go to our reporter Sun Ye in Beijing. Hello there, Sun Ye. Well, first of all, what has Sinovac been saying about its validation by the global health body?
Well, Toni, in a statement released overnight after WHO approval came out, Sinovac's president Ying Weidong was quoted saying that the Sinovac vaccine's various stages of trials across the world, including in Brazil, Turkey, Indonesia, and other countries, have shown that its development process as an example of global cooperation in fighting the pandemic with the use of science, and that Sinovac at this point would step up in its contribution further to let the vaccine be a global public good to the best of its capability. And in another note, the European Medicine Agency has started a rolling review for the Sinovac vaccine recently, and that's the first step in getting EU's approval. And a bit more on Sinovac's efficacy. Sinovac released results from the Brazilian town Suriname on May the 31st, where the results say completing the 2-dose Sinovac vaccine process has helped cut the number of deaths by 95%, reducing 86% of the hospitalization there. Dongning.
Well, so yeah, 2 Chinese vaccines have been approved so far, Sinopharm and Sinovac. So would you please give us a sense of how they have been used around the world?
Well, Dongning, we look at the Sinovac vaccine first. It was granted emergency use in China last June and has, by its account, become the biggest provider of COVID vaccines in China, and also says it's China's most exported COVID vaccines. The company reports that it has provided over 40 countries and regions, and that's at some 600 million doses globally. It also says 430 million doses have already been administered across the world. And the Sinopharm vaccine also had a similar timeline, as it got the WHO emergency approval less than a month ago on May the 7th. The Sinopharm vaccine has also been approved by over 80 countries and regions. Dongning.
Thank you very much, Sun Ye, reporting from Beijing. Well, the increase of the world's access to vaccines and make them more affordable, China has offered medical assistance to 80 countries, exported over 600 million doses to nearly 40 countries and regions, including Turkey and Indonesia. So for more on this, let's go live to Michal Bardavit in Antakya and Sukina Luwalia in Jakarta. I'll go to Michal first. Turkey is among the first countries to purchase Sinovac's COVID-19 vaccine. And Turkey's health ministry declared the China-made vaccine significantly effective. So, Michal, how is Turkey's vaccination campaign coming along, and how have the Chinese-made vaccines helped?
Well, Turkey's vaccination program has been progressing steadily but slowly. The government hopes to speed up this program this month. The government so far has administered over 29 million doses of vaccines. Over 12 million have received both of their shots. This week, the country began to vaccinate those over the age of 50. Now, Sinovac Biotech's vaccine has been incredibly significant for Turkey. So far, over 75% of those vaccines administered in Turkey have been from China. Turkey signed a deal to purchase 100 million doses from Sinovac. Turkey's President Recep Tayyip Erdogan and Turkey's Health Minister Fahrettin Koca were among those who received the Chinese vaccine from Sinovac, so it's been really vital for their health as well. Now, the country entered a normalization phase on Monday following 2.5 weeks of a strict lockdown. This has helped lower daily case numbers from around 60,000 to around 7,000 this month, but the government is really relying on the vaccination program to keep these numbers to daily numbers low, and the government is hoping to prevent further spreading by vaccinating about 60% of the population by the end of the summer.
All right, thank you. Well, in Indonesia, a recent real-life study among more than 120,000 healthcare workers who received China's Sinovac vaccine has found that it's highly effective at preventing death or hospitalization due to COVID. So, Sukina, can you tell us more about this study?
Yeah, this is a huge progress in Indonesia's fight against the virus. The number of deaths were very high in the medical industry when the pandemic began, and this was naturally concerning for the government. In the study, Indonesia's health ministry found that 2 full shots of China's Sinovac was 98% effective in preventing death and 94% effective in preventing COVID-19 symptoms. The study basically showed that Sinovac reduced the number of deaths among health workers to 0. So that is a huge milestone and could help people feel more comfortable to get vaccinated, because experts say in Indonesia there is still a 20% vaccination hesitancy, and that's equivalent to 50 million people. So this study, along with Sinovac's recent approval by the World Health Organization, can help the Indonesian government reach their target as early as 2022. So far, they have vaccinated around 9 million people, and they hope to reach at least 30 million by the end of 2021. Recently, Indonesia also introduced their private vaccination program, where companies are able to get their hands on vaccines easily, specifically those manufactured in China. But the recent study and the approval will not only help Indonesia's health industry, but also the country's economic development. We know that in the past year, the pandemic had a huge impact on Indonesia's economy, and one of the reasons the government is pushing their vaccination program so much is because they want to reach their economic target this year. It will finally allow private companies to restart their businesses as usual and contribute to Indonesia's overall economic growth. So we are seeing these new information as positive and as the boost that Indonesia needs to reach their ultimate target.
Encouraging results of the study indeed. Thank you very much, Sukina Luwalia reporting from Jakarta, and earlier Michal Bardavit reporting from Turkey. Now, let's look at another study in Brazil which says the Sinovac vaccine can reduce deaths by 95%. Brazil's Instituto Butantan conducted the research in the city of Ceará in Sao Paulo. And on Tuesday, Sinovac explained the results, saying almost all the adult population of the city, some 27,000 people, were vaccinated between February and April. The data show the number of symptomatic cases fell by 80% and hospitalizations fell by 86%. The study also finds that the spread of the virus was contained once 75% of the population was immunized. Sinovac says it has supplied over 600 million doses of its vaccine to over 40 countries by the end of May. And the company says the study proves the vaccine's effectiveness against the major CoronaVac variant in the city, which has also been reported in over 37 countries.
In Brazil and many other places in the world, more and more coronavirus variants have been reported. In Tirana, from this March to May, the P.1 variant was dominant. Earlier, people worried whether the vaccine would still be effective against the variants. Our study proves our vaccine has very good effects against the variants in Brazil, especially the P.1.
Now, China's Sinopharm has rolled out the first batch of vaccines for the COVAX program. The Chinese Foreign Ministry said this proves China's efforts to provide products for global health. And the packaging can monitor outside temperature to ensure the vaccine does not go bad. Sinopharm's vaccine received emergency use approval from the World Health Organization in early May. Now, for some analysis on this, we're now joined by Mr. Wu Zhiwei on the phone. He's a professor and director of the Center for Public Health Research at the Nanjing University Medical School. Professor, welcome to Global Watch. Well, first of all, what does it mean for a vaccine to be listed on the WHO emergency use?
Well, this is very meaningful because so far this is the second Chinese-made vaccine putting on the UL list, and also right now there are a total of 7 of vaccines in the COVAX program. So this is actually a tremendous boost to the WHO's effort in equitable distribution of the vaccines. We know that the WHO created this COVAX program and basically trying to aim to provide or cover at least 10% of the needed population, particularly in those low and middle-income countries, to prevent the virus from spreading. But so far, the COVAX program has been struggling with the vaccine supply issues because of a number of issues like vaccine production, and also the wealthy countries procure a tremendous amount of vaccine produced in early phase, which actually basically created a bottleneck for the vaccine equitable distribution. So the China, as the largest vaccine producer, joining this list would be a tremendous help in terms of supplying vaccine to the low and middle-income countries.
Right, and what does it mean for Chinese vaccines specifically, given the fact that Chinese vaccines have not been approved by countries like US, some European countries yet?
Well, actually, this is a little bit complex issue so far. But I think the key issue is that the Chinese vaccine, like COVAX, like the Sinovac vaccine, is an inactive vaccine, which actually requires less stringent storage conditions than the Pfizer and the Moderna vaccines, which actually is a particular advantage for low and middle-income countries. They don't have to build up logistic chains, storage facilities. So in just quite the normal conditions, actually, they could utilize this vaccine. So it's extremely meaningful for those countries.
Well, you mentioned that this approval could affect global distributions. But why are poorer countries the main beneficiaries of Chinese vaccines?
Actually, as I just mentioned, there are a number of key issues here that in the early phase of vaccine productions, the wealthy countries, particularly the Western European countries, actually, they ought to be in charge to procure most of the vaccine produced. So those countries actually stockpiled tremendous number of vaccines, some even more than what they really needed. So China has been, the major supply of vaccines to those low and middle-income countries. If you look at the Chinese exporting of the vaccines, 40% of the vaccines made in China so far has been exported to other countries, either through bilateral contract or by humanitarian assistance. So the COVAX program would be another major, multilateral mechanism for Chinese vaccine to go into those needy countries. I think this is extremely meaningful for fighting the pandemic.
Thank you very much, Professor Wu Zhiwei from Nanjing University Medical School. Now, the World Health Organization, the World Trade Organization and the International Monetary Fund and the World Bank as well called for stronger efforts to equitably distribute COVID-19 vaccines. In a joint press conference on Tuesday, the four multilateral institutions suggested that countries around the world invest $50 billion to facilitate fair access and distribution of COVID-19 vaccines, adding this was necessary for the world to end the pandemic quickly and ensure global recovery. And the four organizations also stressed the importance of speeding up the supply chain for vaccine distribution. And World Bank President David Malpass pointed out that it's vital that the United States frees up excess COVID-19 vaccine doses for Latin America.
Each of us has an important role in this global vaccination effort. My immediate priority is for countries that have sufficient supply to quickly release doses to countries that have vaccination deployment programs. The World Bank has $12 billion in vaccine financing available now and more if needed to help countries buy and distribute COVID-19 vaccines and to encourage vaccinations. These next few weeks are vital that, in particular, the U.S. frees up excess to go to programs that exist.